my boots, going back to my roots, yeah, to pay some my burden, back down to earth.
We've all heard the old adage at one time in our life, drink 8 glasses of water a day and it will help you feel better. But is that really the case? Hello, I'm Mark Thomas, and during the next hour we will take a closer look at the WaterCure and endeavor to sort out the facts from the fiction. Helping us to do just that will be Dr. Robert Brown. Dr. Brown is the Chief of Infectious Disease at Wyoming Valley Healthcare System. Robert Butts. Bob is a local businessman and a strong proponent of the WaterCure. And Dr. F. Batman Gelage, author of several articles and a book on our need for water and its connection to illness. You are also invited to be a part of tonight's program by giving us a call at 1-800-326-9842 with questions and comments on the WaterCure. And our first question is going to be for Dr. Batman Gelage. Thank you all for being with us here tonight. Doctor, a lot of people have heard in some form or another of the WaterCure, or what they believe is the regimen of the WaterCure, but help explain it for everybody, because I think some people believe it might be 6 glasses, 8 glasses, no salt, lots of salt. What is it that you have proposed to be the necessary thing to do?
I discovered that water relieves pain of peptic ulcer disease. And in 2 years and 7 months, I treated over 3,000 people with peptic ulcer disease with only water. I asked myself, these people were thirsty. They didn't have a disease condition, although they had all the symptoms, signs, bleeding, and everything else. So when it came the time for me to research my concept that this was a thirst situation, I asked myself, why does the pharmaceutical industry want to treat this condition with antihistamines, Tagamet, Zantac, and whatever? So I went into the research of histamine, and I discovered that histamine actually is a neurotransmitter in charge of water regulation and drought management of the body.
Okay, so you were presented with a group of individuals that you were treating for a specific disease, but out of all of that, how did you come to, and what do you believe is the regimen that someone should follow? I
continued the research for the past 20 years of the role of water, and I reached the conclusion that the human body doesn't show its dehydration by a dry mouth. Dry mouth is not an accurate sign of dehydration, and we should prevent dehydration. And at the time, I treated the peptic ulcer disease patients with 2 glasses of water every 3 hours. And then gradually I refined it to about 6 to 8 glasses of water, and they all responded under stressful circumstances to 8 glasses of water.
Okay, Dr. Brown, what is, for our audience that may not know that, the peptic ulcer that Dr. Batman Gelage is talking about? And do you find his thought there that there would be some validity to that?
Well, peptic ulcer is pretty much like a sore somewhere in your gastrointestinal tract, usually in the stomach or the duodenum, which is the first part of the small intestine. I find that this is fairly unconventional thinking. It's something that I'm not aware of, have not really seen in the literature that I've actually pretty much scanned and read over the last 30 years or so. I am the Chief of Infectious Disease. I also run the Department of Medicine, so that I actually keep an eye on a good part of the medical literature so that I can oversee all the different specialties in the Department of Medicine.
And really what we're talking about here isn't really anything new from the standpoint that people have always sought different cures for different illnesses when they felt that conventional treatment may not be working for them, from bee stings for multiple sclerosis patients to other types of shark cartilage for cancer patients.
And there's a big push towards alternative medicine, and I think that comes out of a lot of the frustrations that we don't fix things very well. The biggest contributions of medicine over the years have been really preventative and the public health. I think vaccines have contributed tremendously. But one has to be careful. I think that from my perspective, good science involves a randomized, prospective, double-blind, controlled trial that shows statistical significance between two different interventions, and then it's peer-reviewed and published. And I think that we should confine ourselves to that sort of data. Just recently, alternative medicine, St. John's Wort, in a number of studies, echinacea in a number of studies, and just in the last few days, a study on ginkgo biloba, have shown by using controlled trials, in other words, giving a large group of individuals one medication and giving them the medication, giving somebody else a placebo, and then blinding it so that both the evaluator and the patient are unaware of what they're getting, showed that there was in fact no improvement in memory or sharpness associated with ginkgo biloba. So you really do need to do controlled trials. We're all human beings, and we all have a lot of similarities, but each one of us is a different organism, and we respond differently to different interventions. So you have to be very careful that what works for one given individual doesn't get purported to work for all of humanity, because that's not the case. You can find individual anecdotes of responses to all different kinds of therapy. So you need to do these kinds of trials to weed this sort of thing out.
Well, Bob, you and I are the only two non-doctors at this table here tonight, so I think we're going to be challenged to stay up with everybody. But let's explain to folks, if you will, my description is a proponent, advocate, whatever you'd like to call it. You have invested your time and your money in your belief in the studies that Dr. Batman-Gelich has done. So I'll ask you to perhaps first finish some of the things that he didn't get to. It's not just the drinking of 8 ounces of water a day. There are other aspects to the approach that Dr. Batman-Gelich has put forward. And how did you get involved?
Well, I came across actually a solicitation for a newsletter. And a guy named Sam Beiser said he interviewed the man who made what he called the greatest health discovery in history. And you kind of say, yeah, right. But yet he made it kind of intriguing. So I did subscribe. I read the interview. Absolutely floored me. So I figured, well, I want to check this a little further. I called a friend of mine who's a very prominent medical doctor and the head of a local hospital, and was at that time. And I asked for his opinion. 4 days later he calls me and says, Bob, this is nothing but common sense. And going to put a lot of us doctors out of business.
Well, yeah, Bob, I agree with you.
So that got me excited.
Yeah, it's nothing but common sense, and no one at this table is going to argue that drinking water is bad for you.
Let me finish what he said. He said, we all knew this, but he said nobody ever explained it the way Dr. Batman-Gelich did. And he said that's where the common sense come in. Because I wanted to interview Dr. Batman-Gelich on a radio program called Just Common Sense at WARD, which we did. Well, Sam Liguori was a program director over there at that time.
Yes.
And he had angina pains for 5 years, and he was faced literally with a bypass operation. Well, Sam jumped on it. He said, I'm going to try it. Within 2 weeks, no more angina pains. Within 4 weeks, no more hiatal hernia. Well, you know, maybe it's a fluke. But it became one person after another after another. And I'm saying, what in the world is this? In fact, Dr. B says, he says, you're skeptical. I said, yes.
So you came to this as a skeptic?
Yeah.
Do you yourself follow the regimen?
Oh, very close, sometimes a little bit more, but I wouldn't think of drinking a drop of caffeine because, for instance, we have 70 employees at our place. And I don't even allow caffeine on the premises. I became so convinced.
Okay. And that's an important point to make here, because it's not just the drinking of the water, but it's also the elimination of caffeine and alcohol from the diet.
Yeah, they're deadly diuretics. So I had to see it over and over and over. And finally, certain illnesses, like asthma. Last year I put up $50,000 if there was one child that we couldn't cure with asthma. Now the whole world knows asthma is a worldwide epidemic. Everywhere but here, because I never saw it fail once with children. With adults, sometimes it takes longer. But the results we're seeing, like I'm in the auto parts business, but I learned to recognize people when they're a couple of quarts low. I mean, like Drew Bauman would come into our place and he looked really rough. And I said, it looks like you've got some health problem. He said, yes, I do. I'm terminally ill with cancer. I've got 26 malignant tumors. Gave me his whole story. I looked at his face. I says, you don't drink any water, do you? He says, no. I said, what, do you live on caffeine? He says, yeah.